A Kenyan that returned to the country on Tuesday, 24th of March. They had been in quarantine for 15 days at one of the government-appointed facilities. Their samples had been taken and returned negative for COVID-19, just like everyone else at the facility. And this Tuesday, they were discharged and advised to observe at least 7 days of self-isolation before they could mingle with the rest of their family. But Wednesday afternoon, an ambulance came calling. Medical officers dressed in protective gear took the Kenyan to a quarantine facility with the explanation that there had been confusion at the laboratory. They were taken for retesting with the understanding that should they test negative, they would be discharged to return home. This coming on a day clarity lacked on the fate of over 2,600 that have been in mandatory quarantine at 53 government-appointed facilities.
We are reviewing. We do have a set criteria where our field medical teams are employing an assessment tool to be able to determine which centers were able to adhere to the quarantine measures.
The hundreds of Kenyans were to be discharged in a staggered manner since Monday this week. But reports of scores that have turned positive while in quarantine have caused extension of the detention by a further 14 days. Some of them accused of disregarding social distancing requirements amidst questions why the government allowed such to happen under its watch.
The day the positive cases were removed from the quarantine site to the isolation or treatment centers became day zero for the rest of the people under quarantine. However, in conjunction with our case management team, we are reviewing this, and we are also looking at deploying testing on the 14th day or 15th day to be able to see how many of those people turn out negative, in which case we'll allow them home.
After you are quarantined one person per room and you choose to sneak out of your room when you think government isn't watching to break the rules, it will be irresponsible and expecting too much.
Released documents seen by Citizen TV require a person being discharged from quarantine to self-quarantine for a further 7 days. Should they share a house with others, they are required to live in a separate room. That should they have to share ablution facilities, they must disinfect them after every use. They must not allow any visitors to their homes. As a condition to be discharged, they are required to sign a form undertaking that should they break any of the requirements, they are to be detained for a further 21-day mandatory quarantine. But their fate is more challenging, especially for people whose homes are outside Nairobi. They have been denied leave to travel up country given the 21-day restriction on movement. For now, they have to put up at hotels and self-isolate for at least 21 days at their cost. These are tens of isolation centers have been identified across the counties in preparation for an outbreak of the COVID-19 should it happen. The isolation centers have capacity to accommodate up to 130,000 people. The centers are at boarding schools, Kenya Medical Training College campuses, polytechnics and colleges. Teams at the Ministry of Health are finalizing on the lists before funding is secured by the National Treasury to prepare the institutions. Sam Gituku, Citizen TV, Nairobi.